Word.
Great life, everyone. Thank you for coming to this very, very special Zoom meeting that we are having right now. This is one of the most requested topic in tungkol po sa autism, and tonight we have the first part of a two-part series. Ang pinakaano po dito, the best thing about this is that the doctor himself, the good doctor, Dr. Mario Ramirez, who's the leading consultant for research in autism and nucleotide supplementation, is the one to conduct this Zoom meeting with us. He will give us insights about autism, the spectrum of autism, and of course, what can nucleotides do about it.
Dr. Mario, as always, you really come through. You really explain it in a way that is very understandable. And I want to thank you for that. You and I have a little history with autistic children.
Yes, that's right.
You created a clinical study, and you had, I remember the first time we did it, 15 families more or less, and they gave weekly reports from the teacher, the mother, and sometimes the doctor.
Yeah, even the therapist.
What?
Even the therapist.
In the therapy.
The therapists themselves, they give reports of how the children improve from physical therapy with the use of dietary nucleotides ImuRegen.
Yeah. So we've seen many successes in that area. And I personally, with my two grandchildren, one of them brings me A report card, solid A's, and calls me on the phone. He's student of the month, things like that. You wouldn't know at all that he had any kind of history or issue. You wouldn't know. And the other one's coming in that direction. So it's nothing less than that we've seen with our eyes, nothing less than spectacular. I wonder if there's anybody. I wonder if there's anybody online tonight who there are 50-some people, 52 people. Is there anyone who has or knows a family that has an autistic child?
I'll just I'm trying to observe what you did. You simplified the things that an autistic child needs. Yung sa gut, yung sa brain development, yung immune system.
Battery level is 85%.
Yeah.
So, parang sobrang simple. Ang ganda ng ano yun.
It's very simple in terms of how nucleotides can cause an improvement in children with autism.
Well, we have seen many, and including recently, the number of children becoming autistic is increasing very heavily in the United States and here. The numbers are going up. And we feel that a lot of that's due to nutrition, the kind of nutrition you need to feed the DNA, which is nucleotides, peptides, oligopeptides, and the minerals. And like the good doctor said, there is no other product that really basically has all the recipe items that you need in order to repair, support your body, and repair your DNA. That's it. The product supports your DNA. And that's the reason, because who's the ruler of your body? Is it your brain? No. Your elbow? No. Is it your heart? No. Your kidney, liver? No. No. Your boss is your DNA. And nobody can counter that. No scientist or doctor can say, no, you're wrong. Because literally, like Dr. Mario said, if you go to PubMed, there's 16,300 clinical studies from scientists all over the world. And when I started this whole venture, there were about 3,000. Now it's 13,000 more. That's pretty incredible, because scientists have figured out that they better look into it and come up with a natural way to improve the body's health.
Hello?
Doc, even yung Immune Plus, because of the ATP, is it more effective than, let's say, the capsule, or it's really about the nucleotides?
In terms of ATP is a lot in Immune Plus, but in terms of adenosine has a lot in nucleotide liquid.
Okay.
And you can see from the slides that we presented Adenosine addresses a lot of the the mood, the sleep disorders,
So it's
behavioral
they really want to
disorders.
try and see immediate or fast improvements, liquid talaga, Doc.
Liquid
So,
talaga, yes, correct. But
so as you said,
if you need energy, I would suggest to give more of the Immune Plus because the Immune Plus is a lot more ATP. So immediate yung effect ng ATP. I've been using Immune Plus with a lot of my athlete friends. Recently, I just gave a few bottles of my Immune Plus to the rafting community who is doing their best trying to win a medal in Malaysia, the ITP rafting, whitewater rafting.
I remember when we had a dengue outbreak in the Philippines, and you were talking to the hospitals when people didn't have money for the blood, and you were telling them the science about it, and then they started following your advice and giving people 2 tablets of Immune Plus, and then
That's right.
they
Yes,
came back in 2 days and they didn't need blood.
We will talk about dengue next time, but give you a gist about the dengue is that we started a dengue study in Dumaguete and Siquijor, particularly in Siquijor, because Siquijor, for a patient with dengue to travel to Dumaguete, it takes them about 2 hours in ferry time to travel from Siquijor to Dumaguete. And if, for example, the patient is already in a severe state the night before, waiting for the transport of the patient from Siquijor to Dumaguete can cause significant damage and sometimes cause death in the patient. So we started giving ImuRegen to patients who are symptomatic in dengue in Siquijor, and by the time the following morning they were supposed to travel back to going to Dumaguete for checkup. When they arrive at Dumaguete, their fevers are gone, their blood picture is better, and significantly you can see the patient are significantly better, looks better.
if you can give a protocol, for example, for someone with autism, what's the simplest protocol when having nucleotides, ImuRegen, Doc? How many?
Well, the simplest protocol that we started to give, particularly the ones in Cagayan de Oro, for children below 10 years old, we give 5 ml in the morning, 5 ml at night, 2 times a day, and that's it. 5 ml for the liquid, the ImuRegen liquid, 2 times a day. And we found that it not only improves or works with children less than 10 years old, we also gave it to older children, like who are 15 teens. Joris and his brother were taking ImuRegen liquid 5 ml 2 times a day. And sometimes because of they live very far, they limit their intake to 5 ml once a day. Imagine that for just once a day.
I think that was a financial issue.
Yeah, that was a financial, and they live very far up north. So traveling and getting the ImuRegen was kind of a big deal for them and difficult for them.
What I did with my grandchildren, I gave them each 1 teaspoon a day, and miracles happened. So
yeah, just even with 1 teaspoon a day, you can get a lot and very good results already. We will talk about dengue next time, but again, with dengue, we started 1 tablet in 500 ml of water, given 2 times a day.
Yeah.
Again, Doc, because of the clinical studies and you simplifying everything, there are really no or few questions actually in the actual topic.
Yeah, because the one thing you have to understand is the function and how ImuRegen helps in the development and the improvement of children with neurodevelopmental disorders, autism.
We have a simple goal: help people, help people, help people. That's
correct.
One of your personal goals, and one of my personal goals is starting with the children. And we like to do that with children who have cancer and autism and other things. So we've been very successful in helping people. And Arnell is a surprise. He knows he could tell a story or two of his own.
Yes. Thursday, our good doctor is here every 9 p.m. to give you insights and, of course, other details on why ImuRegen is affecting different facets of life like autism, guts, and dengue, etc. Because this product is not a placebo product. It's backed by scientific studies.
Correct.
Yeah. So, because our doctors always simplifying this explanation, you are readily absorbing in it. Sabi nga, you can explain it. What will it do when I give some, if I have an autistic child, what will it do? Better sleep, better immune system, healthier gut. Bam, it's finished.
Yeah.
So,
And the slide
I read a lot,
the slide that shows how adenosine works and helps improve, that's very important. Just if you took a video of the screenshot of that slide, that's
Yes,
very, very important.
wow.
Okay. Thank you everyone for joining us tonight. Again next week.